Are you born as a male but feel as a woman from inside? Hormone therapy can be the one of the options to deal with this distress. In feminizing hormone therapy, we usually give female hormones in the body so that person can align with their own gender identity. But there are 4 key criteria in order to start with your feminizing hormone therapies. So, first is that you should have a persistent and well documented gender dysphoria or gender incongruence. So, in order to start the hormone therapy, you have to take a GD certificate, which is known as gender dysphoria or gender incongruence certificate, from a qualified mental health professional. The second point is that the client must be well informed by the doctor about the whole process of the hormone therapies, including the fertility and reproductive potential preservation options. Third point is that if you are not at your legal age of adulthood, then all the criteria for hormone therapy must align with the adolescent's criteria. And fourth, the last but not the least point is that any medical or mental health issues must be controlled before starting the hormone therapies. So now, if you visit your doctor for starting the feminizing hormone therapy, the doctor might suggest you few of the evaluations which you might undergo. The doctors follow international WPATH guidelines or national guidelines which are known as IPATH guidelines to initiate the hormone therapy. Many a times community members go to any quack providers or without any supervision start taking their hormone therapies, but that is highly discouraged. You should never take the hormone pills or hormone injections by yourself without a proper registered medical professional's consultation. The healthcare provider might write a few blood tests for you to evaluate your medical status. For example, after taking the medical and family history, the doctor might ask you for the screening of heart-related issues, blood-related issues, blood clot-related issues, liver-related issues, and also the breast cancer, prostate cancer risk might be evaluated by the doctor. The doctor might also check for your liver function test, your kidney function test, maybe your blood sugar level, your blood cholesterol level, and your total cell counts in the blood. The doctor might also start discussing about any infectious diseases you might have, or might check for any sexually transmitted infections and HIV. Also, the doctor might ask you about your vaccination history, specifically related to HPV vaccination. Doctor might also ask for any substance abuse, and we strongly recommend to reduce or quit your substance or tobacco use before starting your hormone therapy. At last, the doctor might also discuss the fertility preservation options like preservation of your sperms, of your ovum, in order to preserve the future reproductive potential. Feminizing hormone therapy differ widely based on where you live, what type of medicines are available, and what is the actual cost of those medicines. Usually, feminizing hormone therapy involves taking anti-androgens or GnRH analogs, which reduce the testosterone, while also supported by the estrogen, which reduces the testosterone production, giving more feminine looks and features to the body. Estrogen is the superhero of the show. It reduces the testosterone production, giving more feminine looks. The most common estrogen used is 17-beta estradiol, which has less chances of blood clots or thromboembolism. Anti-androgens reduce the testosterone levels or might impact the male hormones. Most common anti-androgens used are spironolactone and cyproterone acetate. Spironolactone is a mineralocorticoid receptor blocker. It may act on the hormone receptors and reduce the testosterone production, but spironolactone can also cause hyperkalemia, which is increased potassium levels. Cyproterone acetate is a progestin with androgen blocking features, and it is a key hormone blocker. Cyproterone acetate might have certain side effects like liver issues, which is hepatotoxicity, depression, and certain brain-related meningiomas like multifocal meningiomas. 5-alpha reductase inhibitors like finasteride may be helpful to block the conversion of testosterone into dehydrotestosterone, but it might impact the mood negatively. Androgen receptor antagonists like bicalutamide cannot reduce the testosterone level but might impact liver negatively, that is hepatotoxicity. Hence, finasteride and bicalutamide are never given as the first choice of drugs in hormone therapy. Another group of hormones known as GnRH analogs like leuprolide or histrelin reduces the production of luteinizing hormones and follicular stimulating hormones in the brain, which indirectly reduces the level of testosterone in the body. GnRH analogs, if given simultaneously with estrogen therapy, are a very good option for reducing the testosterone levels in the body. But it is not widely used type of hormone because they are costlier than other hormones. Apart from being the lower side effect, GnRH analogs can also be given to those transgender women who are not very much comfortable with anti-androgens or need a lower dosage of estrogen. Sometimes progestins are also given in the hormone therapy for their possible effects on breast development and mood. But these are at a very nascent stage in research studies and not widely used in the hormone therapies. You have to keep very much patience as well as perseverance when starting the feminizing hormone therapy. Let us discuss one by one the effects on the body which can happen after starting the feminizing hormone therapies. Breast development generally starts after 3 to 6 months of initiating the feminizing hormone therapy, and the maximum effect of breast development can be observed after 2 to 3 years of starting the hormone therapy. There is generally no observable effect on the voice of the transgender woman after starting the feminizing hormone therapies. With respect to body composition, there is weight gain and fat redistribution in the body. The lean muscle mass decreases as well as the strength also decreases. There is generally increase in the fat mass as well as visceral fat. The effect on body composition starts after 3 to 6 months of initiating the hormone therapy, and the maximum effect is seen after 1 to 3 years of initiating the feminizing hormone therapies. With respect to reproductive system, there is testicular atrophy, reduction in the size of prostate, and reduction in the quantity and quality of sperms produced. The onset is generally after 3 to 6 months of initiating the hormone therapy, and after 3 years of the hormone therapy, the maximum effect is seen. After 1 to 3 months of initiating the hormone therapy, there is reduction in male pattern baldness. Also, the facial hairs and body hairs become softer, and after 6 to 12 months of initiating the hormone therapy, even the terminal hairs reduce. The maximum effect on the hairs is generally seen after 4 to 5 years of initiating the hormone therapy. After 3 to 6 months of initiating the hormone therapy, there is also softening of the skin, also reduction in sebum and acne. After 1 to 3 months of initiating the hormone therapy, there is reduction in libido, that is sexual desire, as well as no spontaneous erections. Maximum effect is seen after 3 to 6 months of initiating the hormone therapy. Although the current feminizing hormone therapy regimens are generally with the lower risk or adverse side effects, but still we must discuss the risk which the hormone therapy may have. Transgender women who take estrogen might have a slight risk, that is 1 to 5% of risk for the blood clots. Hence, they should stop smoking, they should maintain their weight, also keep their blood pressure in the normal limits. There was a meta-analysis studying the lipids in the bloodstream of transgender women. The study showed that there is no substantial increase in or change in cholesterol levels in the blood. However, after 2 years of initiating the hormone therapy, there is higher chances of having the triglycerides. But the study didn't have any conclusion whether those triglycerides have any impact on the long-term health of the transgender women. Transgender women on hormone therapy might also have the higher risk of insulin markers resistance, as well as higher risk of type 2 diabetes. But still, more researches need to be done to confirm its presence. The effect of hormones on blood pressure is different in different studies. Both systolic and diastolic pressures have been noted, but in some of the studies it was suggested that estrogen might increase the blood pressure in transgender women. Still, more studies need to be done. Liver problems in transgender women might be due to hepatitis or alcohol use rather than hormone therapy itself. But still, it's always a good idea to constantly check for liver enzymes. Prostate cancer is rare in transgender women, but still there are few reported cases of prostate cancer after the age of 50 in the transgender women. Transgender women might have a small risk of breast cancer, especially in those transgender women who have developed breast tissue after starting their gender affirmative hormone therapy. The risk might be higher in case of persons who have Klinefelter syndrome or BCR2 mutation or have any family history of breast cancer. Hence, regular breast screening is a must compulsory in transgender women. Estrogen as a hormone has a role in bone metabolism. So, transgender women must screen for bone densities at regular intervals, especially those transgender women who also have factors like vitamin D deficiencies, poor nutrition, or lack of physical activities in their lifestyle. Estrogen might also impact the prolactin levels in the body. Hence, it is important to regularly check for prolactin levels in the blood. However, the risk of developing prolactin related tumors is very less. Sometimes a few clients come to us who are aged more than 50 years of age, but there is a very high risk of blood clots, stroke, or even heart diseases in transgender women who start hormone therapy after the 50 years of age. Hence, starting at the later age, taking a longer time to start the hormone therapy, or taking a higher dosage of hormone therapy might have results of feminizing hormone therapy with the associated health problems. We generally don't have many studies to know how feminizing hormone therapy impacts the cardiovascular health of a transgender woman. Although we know that certain conditions like arteriosclerosis might impact the cardiovascular health in the transgender woman itself, even myocardial infection rates in transgender women are higher than cisgender women, but very similar to cisgender men. In postmenopausal cisgender women, estrogen therapy might increase the risk of strokes. The risk depends on which type of estrogen is used and when the hormone therapy is started. In transgender women, very similarly, the hormone therapy might also impact the risk for strokes. Transgender women might also have higher risk of HIV in their lives. But there is always a question. If I am a HIV positive person, can I start my feminizing hormone therapies? So yeah, researchers have shown that certain HIV medications might have impact on the hormone therapies. It is shown that transgender women who are taking entricitabine and tenofovir for their HIV prevention might not have enough amount of these drugs in their bodies if they are on hormone therapies. Hence, while discussing the gender affirmative hormone therapy plan, the HIV prevention or protection medication plan should be discussed wisely with your doctors. If your surgery is for longer period of bed rest time and might have the risk of blood clots, then your doctor might recommend you to stop the hormone therapy 2 to 6 weeks before initiating the surgery. And if stopping the estrogen is not an option, then instead of pills, the doctor might recommend you to use estrogen patches. Before the surgeries, the transgender women should also work on regular exercises, reducing their weight, staying away from drugs or alcohol or smoking. This might also reduce substantially the risk of the surgeries. After the surgery, the doctor might prescribe you medications for reduction of blood clots, and you should not start your estrogen therapy until they start walking around well before starting their estrogen therapy. That too with the proper advice and consultation of a registered medical provider. At the end, your transition journey is equally important to us. You can consult our doctor, endocrinologist, and hormone specialist wherever you want. Whether you are beginning your transition journey or at the mid stage of your transition journey, we are always there for you.